As of my last update in September 2021, there has been no reported smallpox epidemic in Mexico. However, I can provide you with a comprehensive overview of smallpox, its history, and the potential implications of an epidemic should one occur. Smallpox, a historical perspective. Smallpox is a viral infectious disease caused by the variola virus. It has plagued humanity for centuries, leaving a trail of death and suffering in its wake. Characterized by fever and the distinctive formation of pustules, the disease often resulted in severe scarring and, in many cases, death. Smallpox was responsible for countless deaths and played a significant role in shaping the course of history. Eradication efforts. The turning point in the battle against smallpox came in 1796 when Edward Jenner introduced the first successful smallpox vaccine. This laid the foundation for vaccination campaigns that intensified during the 20th century. The World Health Organization, WHO, launched a global campaign in 1967 with the aim of eradicating smallpox. The last naturally occurring case was reported in 1977 in Somalia, and in 1980, smallpox was officially declared eradicated. Remaining threats and controversies. Despite eradication, concerns linger due to the existence of smallpox samples held in two authorized laboratories, one in the United States and another in Russia. The possibility of these samples being misused for bioterrorism remains a topic of international concern. Stringent security measures are in place to prevent unauthorized access and release of the virus. Potential implications of an epidemic. If a smallpox epidemic were to occur in Mexico or any other part of the world, it would pose significant challenges to public health and global security. Here are some potential implications. Highly contagious nature. Smallpox is extremely contagious, with the potential to spread rapidly within communities. This would require swift and coordinated efforts to isolate infected individuals and trace their contacts. Limited immunity. Since smallpox vaccination ceased after eradication, a large portion of the global population lacks immunity. This could lead to a higher susceptibility to the virus, resulting in a more extensive outbreak. Healthcare system strain. A sudden outbreak of a highly contagious and severe disease like smallpox would strain healthcare systems. Hospitals and medical facilities could quickly become overwhelmed. Vaccination campaigns. To control the outbreak, mass vaccination campaigns would be necessary. However, producing and distributing sufficient vaccines in a timely manner would be a logistical challenge. Social and economic disruption. An epidemic would likely lead to fear and panic, causing disruptions in daily life and economic activities. Quarantines, travel restrictions, and trade disruptions could have far-reaching consequences. International response. The international community would need to collaborate closely to contain the epidemic's spread. Coordination between countries, sharing of resources, and expertise would be essential. Biosecurity measures. An epidemic could lead to increased scrutiny of biosecurity measures concerning stored virus samples. Stricter regulations and inspections might be imposed to prevent misuse. Public communication. Clear and accurate communication from health authorities would be crucial to prevent misinformation and panic. Providing guidance on preventive measures and treatment options would help minimize the impact. Ethical and moral considerations. Balancing public health measures with individual rights and liberties would be a challenging ethical dilemma. Measures like quarantine and isolation could infringe upon personal freedoms. Conclusion. While smallpox has been eradicated, the potential for its reappearance through deliberate release or accidental exposure remains a concern. An epidemic of smallpox, whether in Mexico or any other country, would be a complex and serious crisis requiring a multifaceted response. Global cooperation, swift action, and adherence to established protocols would be essential to contain and mitigate the impact of such an event. It's important to note that my information is current as of September 2021, and I recommend consulting up-to-date sources for any recent developments regarding smallpox or potential epidemics.